It's 8 o'clock, and welcome everyone to today's episode of Marvelous Medicine. And Dr. Anil Nanda will be speaking on poignancy and punditry in healthcare. He's the Peter W. Carmel Endowed Chair and Professor of Neurosurgery at Rutgers, New Jersey Medical School and Robert Wood Johnson Medical School. He's an internationally recognized leader in skull base and cerebrovascular surgery and has built a distinguished record in patient care, education, and global collaboration. He has authored more than 500 peer-reviewed publications, written multiple textbooks, and delivered over 1,500 invited lectures worldwide. He has served as president and in senior leadership roles across numerous neurosurgical organizations and is a long-standing contributor to the World Federation of Neurosurgical Sciences, where he is the editor-in-chief of the WFNS journal. Dr. Nanda is committed to expanding access to high-quality neurosurgical care through education, mentorship, and strategic global health partnerships. He's also done a master's in public health, about which probably we'll get him to talk on on another occasion. Moderating the session will be Dr. Shalini Rajaram. She's a director professor, VMMC and Safdarjung Hospital, Delhi. She was formerly the professor and program lead of the MCH Gynecological Oncology at AIIMS Rishikesh. Dr. Shalini has been the past president of Association of Gynecological Oncologists of India, Asia Oceania Research Organization on Genital Infections and Neoplasia India, Association of Obstetricians and Gynecologists of Delhi, and Society for Vaginal Surgeons, Delhi. She has more than 200 journal publications, 18 books, more than 100 book chapters, and more than 300 guest lectures, including 10 orations. She has keen interest in skilling and mentoring super specialty trainees and HPV diagnostics and hereditary cancers. She has received more than 65 awards, the most recent of which is Dr. Shubodh Mitra Oration for February 2025, awarded by the Bengal Obstetrics and Gynecology Society. She has also previously received the Best Researcher Award from AIIMS Rishikesh. Thank you, Shalini, for making the time. And last but not the least, we have Dr. Patta, who doesn't need introduction to Marvelous Medicine audience. However, for formality, he is the head of GI surgery at SIMS Hospital, Vadapalani, Chennai. After doing his MBBS from JIPMER, Pondicherry, he went on to do his MS surgery from Stanley Medical College and the MCH gastrosurgery from Madras Medical College. After that, he worked in All India Institute, and he is Dr. Samaran Nandi is his guru. He started the Facebook page Learning General Surgery, which has over 46,000 members, and new members keep joining every day. And Marvelous Medicine was his brainchild, for which I was his partner in crime, and now we have come 5 years. Other than this, he's a very talented interviewer, and one of our guests on Marvelous Medicine mentioned that he reminds him of Stephen Bartlett from The Diary of a CEO. So once Dr. Nanda is finished with this talk, I am sure Radhakrishna will be able to extract a lot more from Nanda. Thank you, Dr. Nanda, for making the time on a working day in the morning, and we are eagerly awaiting your talk.
Can you guys hear me well?
Yes.
Well, thank you for this privilege. I really feel very privileged. I don't know if I'm worthy of this, but I want to thank all of you. Vidya was very kind to invite me, and Monica Vasikan is a real dear friend of mine, from my classmate from JIPMER. And as you'll see, I'm not very objective about JIPMER. I thought it's a great medical school. I feel very blessed to have gone there. So I look forward to talking to all of you. And, this is not a talk that is just neurosurgery, a little dipping into neurosurgery, but I just thought let me just get this going here. Yeah, okay. So, again, I want to thank Shalini. I want to thank Dr. Radhakrishna, and again, thank Vidya. So thank you for using it. I think Marvelous Medicine is a beautiful title because it is it's a marvelous profession that has marvelous dimensions, and all of us are so blessed to practice this. So I'd like to dedicate this talk. I read this in the New York Times about this lady, Timmaka, who died in Karnataka at the age of 113. And she never had children, and that really bothered her. And so she planted trees, and she planted thousands of trees. And I think that's Nishkam Karma, as the Gita defines it, that, doing good for others. So I think it's so important to remember that we who lead a life of service, here's somebody who did an amazing job, and her obituary was a full page in the New York Times, and it's something all Indians should be proud of. And I think you come from a lineage where Matru Devo Bhava, Pitru Devo Bhava, Acharya Devo Bhava is very important. And I would be silly if I did not pay homage to Dr. Rammurthy. I was privileged to give the Rammurthy oration 2 years ago, and he was like, I remember my father first introduced me to him, and I almost feel like I wish I'd done Sashtang Namaskar to this man who was just amazing. And he came up with the term Airam Chinta Mani, that this demon that took away 1,000 heads, because neurosurgery at his time had a high mortality. And then my own personal sort of guru was Dr. Chandrasekhar, who I met at the age of 90 a couple of months back. Great guy. And then some of these people have passed. Brother McPhillamy was a great teacher of mine, and my parents, and of course my personal guru Sai Baba. So thank you so much. It's always good to acknowledge that. And this is me when I first came to JIPMER. I came from St. Columbus High School. It was a great medical school, and I'd never been there. And I had a wonderful time there, and I'm always very grateful for that. And for having lived in Pondicherry, I just was in Matri Mandir again, and, this Life of Pi. It was a great city. I used to always go to the Manukul Vinayagar temple. It was one of my favorite spots in Pondicherry. I'm a, big follower of Ganesh, and it was a wonderful time. So my talk, I might switch it around. Initially, I said poignancy, and I said, let me start with punditry. Pundits are normally Brahmins. They go first, so poignancy will come later. But I'll talk a little bit about history, equanimitas, punditry, complications, compassion. So, our art is a great historical art. And if you look at the Greeks, they talked about Zeus having a bad headache, and Hephaestus comes and cracks open his skulls and delivers Athena. To some, that's the first neurosurgical operation. To others, it's the first OB. So Dr. Shalini will say, okay, no, that's an OB person, but just sort of an interesting backlight. And in Egyptian mythology, it was not the brain. I mean, they just suctioned the brain out transphrenoidally for the mummies, but they thought the spine was really important. So the legend of Osiris being killed and his wife looking for his 7 parts of the spine to put it together to bring him back to life is sort of a neurosurgical thing. And then, of course, whether you're a Shaivite or a Vaishnavite, you will always agree that Ganesh was the first neurosurgical procedure. So I always feel that as a devotee of Lord Shiva, I come from that lineage to do this stuff, and we're very blessed to perform that. These are some of the first sacrificial things that were used for neurosurgery, the tumis, and they were used to crack skulls open. And if you see here, the edges had healed. So trephination goes back almost 20,000 years all over the world, in China, Peru, and Egypt, and unfortunately, it was mainly on young women, and was done as a cure for craziness and sort of that gender politics of that era. But what's important is the edge of the brain always heals, so they survived that. And then I think in terms of art, you look at the skull, and this whole thing, the skull was a reminder that you are mortal, that you will die. So memento mori was there's a ring here that first showed the skull, and this is, this way it was. And then the popes would always say, listen, you're going to die. And if you look at Western art, you'll always see a skull at the base of the cross, and that's supposed to represent Adam. So every culture there in the arts, you can see Gustav Klimt, Van Gogh, everybody pictures the skull, and it's always, memento mori, think of your death. And of course, in our own culture, if you look at Durga, she has a string of skulls. Again, Lord Shiva has a string of skulls, and it kind of reminds us of our mortality. And then there's a whole genre of paintings with skull, the Vanitas oeuvre, where you have a skull next to other objects like an apple that tells you, listen, your time is short-lived and you never know when it's going to get over. And again, if you think of Andy Warhol, Picasso, everybody, Basquiat, they all painted skulls. So I'll now segue a little bit into equanimitas. I think my professor, Dr. Chandrasekhar, he really represented equanimitas. And, when we were medical students, we all aspired to that calm. And Osler, in the address that he gives in 1893 to the Medical School, University of Pennsylvania, first talks about equanimitas. And he really practiced this. And it was like, if you the line from Marcus Aurelius' meditation is that thou must be like a promontory of the sea, which the waves beat, but it stands still. And Narasimha Rao actually first introduced all of us to this term from the Upanishads, where he said, Ma bhaya ma samikta, neither daunted in defeat nor triumphant in victory. And I think that's a great thing between punditry and poignancy, that we have this equipoise, this balance, and we don't sort of have this hubris that, I'm God's voice on this, or we are so timid that we said, oh, this is not what we're going to do. It's interesting, Osler was sort of the Gandhi of medicine. So if you look at, how our role models are, unfortunately, Halsted was not a great role model. Halsted had a morphine problem and a cocaine problem. Today, if he applied for privileges in any American hospital, he would not get them because he would fail the drug test. But Cushing was his prodigy and obviously started neurosurgery. And, Halsted was brilliant. He did a gallbladder operation on his mother or his sister right on the kitchen table. So he was a very brilliant man, but deeply flawed. Just a sort of little aside, he marries his operating room nurse, and she gets dermatitis on her hands. So he goes to Goodyear to say, "Can you put some gloves on?" And that's how surgical gloves come. So it's kind of an interesting topic about Cupid's arrow and Asclepius, kind of an interesting aside. So when you come historically, I think 1912 is a very important year. It's like 106 years ago. It's the first time you go into hospital, your chance of surviving is better than 50%. Before that, you're into the hospital, the more than 50% chance you're going to die. So, as the old Virginia Slim ad says, you've come a long way, baby. We really have. We've come to a point where mortality is very low. So when I talk about punditry, I think it's important, people have described this era as the post-truth era. And I tend to agree. I mean, we don't know what the truth is anymore. Should we be vaccination, no vaccination? Should we have a lockdown, not a lockdown? And I think punditry has become really a problem with social media. Everybody has an opinion. I mean, my sister-in-law is so very well educated, and she's like, "Oh, we never went to the moon." That's what TikTok says. I'm like, okay. So punditry is where there's overconfidence, there's some media amplification, and I'm sort of social media naive. I've never been on Facebook. I don't have an Instagram account. So I'm sort of a Luddite. I still read my newspapers and people make fun of me. But that's just, I'm sort of a dinosaur on that. But they focus on hot topics. They want likes. They want the public perception. But I think there's real dangers to it that I think COVID taught us. And I think historically, when you look at medical punditry, you can see it goes back thousands of years. So when you look at gladiators, okay, this was considered if you drank a gladiator's blood, it was supposed to cure epilepsy. And it's like happened for hundreds of years. Like a totally crazy concept today, but it was widespread, okay, it did occur. So, a strange thing, but this is a form of punditry. And then bloodletting. Bloodletting was a great disaster. I mean, you can see the Greek ways from like 2,500 years, they're doing bloodletting there. And it was like, okay, this is going to cure you. And people died because of this. I mean, one of the things in American history people always talk about is that bloodletting led to the death of Washington. It's probably the first malpractice case because a lot of physicians said he had a common cold. He didn't need bloodletting. They did bloodletting on him and he died. Same thing with Charles. Just something to think about. And then in our specialty, Moniz gets the Nobel Prize for lobotomy. It's like he should have got the Nobel Prize for angiography because it changed medicine. We could diagnose subdurals, we could diagnose brain tumors, but he gets it for a lobotomy, which was probably one of the worst misadventures of modern medicine. If you look at Freeman and Watts, is a great book on this. I mean, and again, there was gender politics here. They were going to them and they would do like 25 women. They would put this ice pick in. This guy was not a neurosurgeon. He was a neurologist. And you can see here, he would just put an ice pick and sweep across the frontal lobe. So a horrible thing, and they didn't have lorazepam or any of these drugs then. Once those drugs came, you didn't need to do a lobotomy. But it irreparably damaged it. And those of you who've seen One Flew Over the Cuckoo's Nest, I mean, this is just a tragedy of what happened. I think this is one of the worst cases. This was a young kid called Howard Dully, and he was 11 years old, and his stepmother felt that he wasn't behaving properly. So they went and did it on him during this transorbital thing, and he survived. And fortunately, he wasn't that cognitively impaired. Just a historical aside, JFK's sister had a lobotomy done. She had some mood, there were six kids, and Rose Kennedy never forgave her husband for putting her through that because she was obviously never the same. So we've had this punditry streak in medicine where we think this is the way to go, and unfortunately, it's not. And I think this was one of, it seems so distant now that we were on lockdown. And, Osler talks about the great three enemies. By the far, the worst is fever. And during the Iliad, Apollo talks about his arrows just smoting down the people. And I think that's what happened worldwide. These arrows of Apollo killed people everywhere. I think there was a neurosurgeon in Chennai that passed. There was a couple of hundred neurosurgeons died worldwide. So it was a real tragedy. And if you look at, sort of pandemics from the past, Petrarch said, nobody's going to believe what we went through. And even to us, this is Bruegel's, the death, and, a third of the planet was wiped out when we had the plague. So it's hard to believe we lived through COVID. It was a terrible time, but also it was a time that showed that there's real racial disparities in medicine. African Americans and Hispanics died at a much higher rate. And it again showed us the health inequality. In Sao Paulo, if you are a black person at the age of 20, you're twice as likely to die if you're than you're a white person. And Michael Marmot talked about this, historically in the 19th century, there were so many blacks having tuberculosis. And the northern doctors said, listen, this is the economy. And the southern doctor says, no, genetics. Well, economy improved and tuberculosis went away. So this punditry of saying this is the only way is probably wrong and misguided. And, I think we did, when I was a resident, we believed in the ECIC bypass. Well, the randomized trial showed it doesn't work. You know what I mean? And it sort of changed medicine the way we had. And I think Marshall and Warren, I mean, when I was a medical student in JIPMA, one of the commonest general surgical procedures we did was a vagotomy, and everybody got it. And now it's like, oh my God, this is heliobacteria that's causing it. And as we know, Marshall injected it on himself to prove he had it, and people laughed at him at national meetings or international meetings. But he had the last laugh. He gets the Nobel Prize. So sometimes punditry does pay off. And I think if there's one slide that I would really emphasize for all of you, this is Michael Collins, an amazing man, ran the NIH, and now I mean, at that time, they were, no, Wuhan didn't cause COVID, nobody caused this. They were very sure. And he promoted the lockdown. And I think this is, if there's one statement you should remember, he says, you attach infinite value to stopping the disease and saving a life. You attach zero value to whether this actually disrupts people's lives, ruins the economy, and has many kids kept out of school in a way that never quite recovered. This is a public health mindset, which another mistake we made. This was medical punditry at its worst. I mean, there's a generation of kids that are cognitively not the same, that are intellectually not the same, whose scores will never be the same. You just can't do virtual education and expect the same results. It's social interaction. It would be the equivalent of saying, I'm going to take out a brainstem tumor because I watched a couple of YouTube videos. If you've not done it, it's not going to be as good. So I think punditry is something that kind of reminds us that perhaps hubris in medicine is misplaced, that perhaps we need to be a little more analytical and open to different views. And we're all guilty of this as we practice. We say, oh, this is the only way because this is the way I learned to do this. So it's kind of something to think about. What about poignancy? Poignancy is the sadness of what happens in medicine. I mean, this is the Wall Street Journal article that came out, I think, 2018. And he said in every hospital in America, there's a Dr. Hodad, hands of death and destruction. This is the public press now. They're saying, oh my God, you got doctors that you're not monitoring that are killing patients. So that's the thing that we need to worry about. This is from the Institute of Medicine. This is now almost over 20 years old. And it's like 100,000 people are dying because of errors. That's the poignancy. And we're all responsible. Maybe some order, something that happened. And this is a great book on Lister. And he said that in the British Empire in the 18th century, the most dangerous place to go to was a hospital in London because you die. This is Florence Nightingale before the Crimean War. And she said, listen, there's bugs everywhere. It's not clean. There's no sunlight. So this is sort of the tragedy that it comes from. And the tragedy extends in terms of poignancy to healthcare. I mean, look at this. This was an article, a letter. It was not peer reviewed. It was just a letter to the New England Journal of Medicine. He says, we looked at 40,000 patients, 11,000 repeat narcotics, and the addiction was only in one or two cases. Two patients, Percodan and hydromorphine. An entire drug industry used this letter to flood it with drugs for patients. When I was a resident in Philadelphia, we were admonished you didn't give enough narcotics to the patient. You're not being kind, you're not being compassionate. And that punditry swung all the way to poignancy. Why? Because America had, 60,000 deaths a year from drug overdose. Young people were getting addicted to narcotics, switching to heroin and dying. And you can see this, the narcotic deaths. A lot of celebrities died. And, 75% opioid addiction starts with a prescription. And, I'm not sure. I know in certain parts of Punjab, there is an addiction problem. All over the world, this is a problem, be it opium or this. So it's something we need to be very cognizant of. But I think also there's hope in medicine. I think disruptive innovations come that change the face of medicine. That, like all this punditry, and then you're like, oh, wait a minute, something new came. So, Lars Lexell brought in the gamma knife, it was a form of radiation. You didn't touch the skull. So small tumors today can be treated that way. My whole career was based on vascular. I clipped over 1,000 aneurysms. It was a big deal. And the glioblastoma comes in and coils the aneurysm, and it changes everything. So it's important to be adapted. It's just like vagotomies went out, antibiotics came in, and minimally invasive spine comes in. So all these things, Clayton Christensen, who was actually one of our speakers, and I had the privilege of having lunch with him, he has passed now, but he came up with this disruptive innovation, and I think that's something that will remove the poignancy and the punditry will be good. So people who come with disruptive innovations in medicine really need to be lauded. I talked about Marshall. I talked about Harvey Cushing. I have to pay homage to Harvey Cushing. Before Harvey Cushing comes along, the mortality for a brain operation is close to 75%. He comes up with a series of acoustics and his mortality less than 15%. Marie Curie comes up with radiation. Joseph Lister makes antibiotics. Antisepsis is a big thing. And even Ambrose Paré, 500 years ago, when people had wounds in jousting fights or during battles, they had burning oil put on their wounds, and he put rose water, and he thought he'd get into trouble. But lo and behold, it worked very well. So that's another thing. Some of the lessons I've learned, I've been very blessed to have done close to 20,000 surgeries. And I think, at least from a surgeon's point of view, how you avoid pitfalls and how do you avoid poignancy and punditry is mastery. And this is Castiglione, who was a great Italian writer, who said, sprezzatura. It's sort of this effortless mastery. And, we have surgeons listening to this that I think that you can see some people are just natural. Ramurthy had it. They could go in and, I was just at a concert at the New York Symphony, and there was this wunderkind violinist playing from Spain who was like 23 years old. And you thought she was in the Turiya state. She was like in Nirvikalp Samadhi playing this beautiful violin. And she had a great line. She said, the violin chose me. And I thought about it and I said, for surgeons, we who are blessed to do what we do, it's almost like the blade picks us, and we're just fortunate to practice a great art. So this is something that technically mastery is something I really sort of worship at that altar. There's somebody with a brainstem cavernoma. Let me see if I can get this to work. And you can see we're going into the brainstem. And this is spezzatura. This is where we get very good at what we do. That's the trigeminal nerve, and we're getting into the brainstem itself. We make a small opening in the brainstem. Yesterday, I took out a brainstem tumor that was inside, and it was a very anxious moment because when you're in the brainstem, you get bradycardia. And, people like Vidya, the anesthesiologist, bail us out. So we had like 3, 4 episodes of bad bradycardia, so I had to stop. Fortunately, we got a complete resection. Patient did well. And this is a cavernous malformation. Surgeons are such bad, they always want to show videos. I'm like, other people are like, why are you showing this video? I was like, we like this. And this is just to show you the cavernous malformation coming out. Uh, and then, these are things that I like to do, like petroclival meningiomas. This is somebody with a bad tumor, and I'll show you a quick video on this as well. I'll take it up there. So again, we're in the brain stems, the retromastoid, the trigeminal nerve is here, seventh, eighth cranial nerve is there. And we were very blessed to get a good resection. She did well. So I think, and I always like to show the brain, like, this is the Sistine Chapel. And if you're like a cardiologist, you're going to say, well, God looks like a heart. You're like a neurosurgeon. This looks like the brain. And I always think it's a wonderful illustration. And it's considered one of the greatest paintings in the Western world. As somebody said, Ajanta Ellora is like 100 Sistine chapels. So, we always have our cultural richness, be it the temple, Brihadateshwara temple in Trichy. So I think all of us have that. But I think technical virtuosity, whether it's internal medicine I think that's an important thing to aspire. If you're a young person starting out, I think that's very important and it helps a lot. I think one of the reasons, this is an editorial I wrote about resisting the siren song. Sometimes, hubris guides you, punditry guides you. You say, I want a really good looking post-op MRI. I went to the brainstem, I took it out, look at the post-op MRI. Well, what about the patient? If the patient is not talking, needs a trach and G tube, that's no victory. So I think we have to balance that you have to resist being too aggressive and yet being safe. And I think that's an important point I like to always emphasize. And then sometimes patient choice becomes a big thing. This is somebody that had 3 kids with a petroclival meningioma. She didn't want any deficit, so I took out some, left a little bit, get the gamma knife, and she's done well for over 20 years. Yeah. But medicine has its humbling moments. This was a spinal cord tumor that I took out, and she was a young girl, and I took it out, and she was paraplegic post-op. And Anna Akhmatova was the Russian poet. When World War I starts, she said, in a single hour, we aged 100 years. And surgeons in the audience will know, when you get a bad outcome, you age 100 years. So I thought, my God, this is horrible. 3 days later, she's moving her toes. She got everything back. She's now 20 years out. She had a baby. So sometimes we get through, but mistakes happen. I mean, you look at this. This is in the New York Times. They did the radiation to the wrong area. So they gave 10 times the dosage for trigeminal neuralgia, which is a fairly innocuous thing, and 6 people died from 10 times the radiation. So this stuff does happen. And then this is, you could say it's the best hospital in the world, Mass General. Orthopedic surgeon wrote this piece about case report. I operated on the wrong side. So these things happen, and I think if we're not honest about them, we don't advance the field. This is a slide I show residents. This is Czesław Miłosz, who was the Nobel Prize poet from Poland, who said in a room where people unanimously maintain a conspiracy and silence, one word of truth sounds like a pistol shot. Always tell the younger residents, medical students, and young attendings, you should be like the pistol shot. Don't just say, "Oh my God, this professor's done all this stuff." I make mistakes, and somebody needs to focus a clear light on that too. I wrote a book on complications, and I think, it's like a dark corner. Nobody likes to talk about it, but I kind of felt that's important. And I think when it comes to complications, we should learn from military history. This is after, if you go to the Eisenhower Museum, the World War II Museum in New Orleans, on June 5th, before D-Day, Eisenhower says, if anything happens, it's my fault. Okay. My decision to attack was based on me. The troops have valor. And that level of accountability we don't seem to have today. We live in a post-truth era. They blame everybody. And, our leadership, our political leadership does that. And I think you can't blame, anesthesia did this, the ICU did this. The buck stops with me. My case, my complication, I own it. This is Robert Liston, who was one of the fastest amputees. So if you have feeling bad about a complication, this guy amputated somebody's leg. He cut his assistant's finger, who died. The patient died, and a woman had a cardiac arrest watching it. 300% mortality. So, it's a way to feel better. And bad things can happen. This is a pituitary tumor I took out years ago. I was dissecting in it. And like everything was going well. I'd taken everything off. It was really good. If you look at the carotid artery there, this is the carotid right there. I was almost done, and you'll see this catastrophic complication, the spontaneous rupture of the carotid artery. So this stuff will happen. I sutured it, but she did not make it. She died. And what do you do when you have complications? I like poetry, so I call this neurosurgical memento mori. This is Agamemnon's poem that, God whose law it is that he who learns must suffer. Even in our sleep, pain that cannot forget falls drop by drop upon the heart, and then comes wisdom to us. When Martin Luther King was assassinated, Robert Kennedy was in a largely black area, and they told him, "You need to get out of here." And he said, "No." And they said, "Well, we'll give you a speech." And he said, "No." And all he said was, "This was the poem that got me through my brother's death," something he never talked about privately, but said that. So something to learn for all of us. And I think, poetry has a long medical tradition. And even Shakespeare talks about, the ventricle and the pia mater. One of my favorite lines of Shakespeare is from The Merchant of Venice: "The quality of mercy is not strained. It droppeth as a gentle rain from heaven. It blesseth both he who giveth and he who receiveth." And we who practice this great art, the quality of mercy is not strained. Whether it's an uneducated laborer or the governor, we treat everybody like God's children. Quickly on malpractice for younger people, that's an issue. I once had a physician who was going to operate in Yemen from Turkey, but he took the evening flight back. I said, "Why are you coming back?" He said, "Well, in Yemen, if you have a bad result, they'll kill you." So they don't operate, guys come in, they fly out. So I was like, okay, I shouldn't complain about malpractice. This just show you neurosurgery is one of the top, it's not a great spot to be number one on, but there are a lot of claims on it. So I think the gist of what I'm trying to say between punditry and poignancy is to have a moment of self-reflection. And I love this self-portrait by Rembrandt. He didn't show himself when he was 60 as though he's 12. He didn't Botox himself. And so I think that self-reflection is important. And we don't want to be like Picasso, whose self-portraits were a little out of here. And this is interesting. Kintsugi bowls. I've used this a lot. That the ceramic Japanese bowls, when they were broken, they were put together with gold, and now they're more valuable than the originals. And I think this concept was in Shah Rukh Khan's movie Pathan, but I had used it earlier. And I think we all have our Kintsugi bowls. All of us remember our worst complications much more than our triumphs. And I think that makes us sort of human on what we do. Uh, just a touch about professionalism and humanism. I think, the first time profession is used is Scribonius, and he says a commitment to compassion. And I think that's very important in what we do. Mentorship is important. And I don't know if any of you have heard this podcast from Dr. Death. I actually knew this guy. He was a resident in Memphis, and he was, paralyzing people. He's in jail right now for manslaughter. So these are, poignancy moments in medicine when people are accused of this. And I once had a surgeon I was trying to recruit when I was at LSU, and he didn't come. He was a brilliant guy. And then 2 years later, I read that he like murdered his wife. I was like, oh my God. So these, we're human and we see bad things happen. But I think professionalism, we shouldn't become cynical. As idealism can become cynicism. But I think wisdom comes to us, like I said, through the grace of God. I think academia is important. My specialized area was skull-based. I published a lot on that. It's meningiomas. I have a textbook coming on meningiomas. I like history a lot, so I've kind of published on history. But I always tell the students, think of something interesting. Think of the extraordinary in the ordinary. And I thought this paper was great, The Cause of Death in Shakespeare's Plays. I'm like, whoa, this is very interesting. And I read the paper. You were stabbed to death more likely than anything else. So I think the part about MPH, I think I have 7 minutes left. The part about MPH, I can talk another time. Rather than go through a midlife crisis, I went back to school when I was, I think, 48, and I did 3 summers at Harvard, and I got my master's. It really broadened my horizon. So most of you know that John Snow's pump and cholera, how they mapped it and showed it actually came from there and not from miasma, the bad air. And people don't realize that the pie chart comes from Marie Curie. She's the one who goes to Scutari and looks at the hospital and say, if you're clean, this is better. And so this is an important thing. And I think we as physicians sometimes don't do enough about public health issues. Public health is like the stepchild of medicine, but COVID showed it's not. These are obesity trends, and I read that obesity in India is an issue because kids are watching TV with junk food. Here's the obesity rate worldwide, Mexico, Saudi Arabia. And if Michelangelo painted David today, it'd be a different picture. So something we as physicians need to be more worried about. Just to talk to you about age and public health, this is a 90-year-old with a ruptured aneurysm. I was like, I don't want to do this. But she said, no, I live by myself. Do it. If I die, that's fine. My punditry was, don't do this. Okay. They twisted my arm. I did this in like 35 minutes. I just told the residents, I'm going to do this, get in and out. She did great. And she lived another 4 years. So sometimes we can be wrong. But I think one of the things that innovation in medicine, it takes a long time. So this is Don Berwick's article where he said that people with scurvy, they knew you give them lemon juice and they're not going to get scurvy. And it took 150 years for the British Navy to say, okay, we should adopt this. So we are late adopters sometime, and we know healthcare is related to social equality. I mean, you look at the Titanic and you can see if you were in first class, you didn't die that much. You were third class, 75% died. And that's true. If you're poor today and you have a brain tumor in America, your survival is less than if you're rich. So I think, I want to end with faith. I think, physicians are taught you don't talk about this, but, I learned a lot. It's funny. I was a Punjabi boy from Delhi. I learned so much from the South and I became a better person. And then I went to the South in America and the faith was incredible. I mean, here was, I remember this brain tumor girl I operated on and she was going to die. And, the last time I meet her before she died, she's, I'm really grateful to God. I'm like, you're dying. What are you? And she says, this whole thing got me closer to God. And I think Tagore's poem is beautiful. Faith is the bird that feels the light and sings when the dawn is still dark. And I think the studies are interesting. Nuns, they compare cohorts of nuns in Italy. If you're a nun, you don't get high blood pressure. So there must be something about this that helps. And I think art shows art poignancy beautifully. This is Luke Fildes' famous painting. His own daughter died, and he painted this in honor of the physician. This is Christina's world, and you can see she had muscular dystrophy. I never knew this till recently, but you can see her arms, and she had to crawl. So this was sort of the aspirational thing, and I think it sort of just gives us sympathy, I mean, empathy. I do think physicians need more time for themselves, whether you meditate or you exercise. This was Lorna Breen, a Columbia physician, very decorated. She committed suicide during COVID. The well-known case of a nurse in Seattle who gave the wrong medication to a patient, a young kid, I think 8-year-old child. The child dies and she commits suicide 2 weeks later. So it's called a second victim syndrome. And I think that's something we should remember. One second. I think this is frozen. Sorry. I think my thing is frozen. Yeah, I don't know what happened here. But I'm almost done. Yeah, one second. Um, I don't know why it's not working. Uh,
You can try coming out of slideshow and then going back.
It looks like Dr. Nanda is logged out, Vidya.
Everything crashed. I'm sorry about it. I apologize. Yeah. Can you see me again? I'm back.
Yes, yes, we can see and hear you.
So sorry. I had 2 slides, so I think I finished in 45 minutes. Yeah. Let me just get back to that. One second. Oh. Can you hear me?
Yes, we can hear you.
Okay, good. One second. I don't know why. It's kind of embarrassing when your computer crashes right in the middle of a talk. Yeah. Um, so what I wanted to say was I'll kind of end up there. Let me just see if yeah, here it comes. Yeah. Okay, good. Can you hear me? One
Yeah, we can
second.
hear you. You need, if your presentation is open, you need to start sharing your screen again.
Dang it. Okay. I just had a few more slides at the end. One second. I'm sorry about this. I apologize. My Mac is 6 years old, and I think the Lord is telling me I need to get a new Mac. Yeah. What I wanted to say, my last slide was about the mystery of faith, and I operate on this. You can see me, correct?
Yes, we can hear you and see you well.
Hello.
We can see you well and hear you well as well.
Okay, perfect. So I'll continue that way. I think my last slides were not much. I wanted to, there was there's a young girl, Hispanic girl that couldn't speak English. She had an AVM in the in the brainstem. She came quadriplegic to us. I took out the AVM. She walked. She did great. But I'll never forget her mother who couldn't speak English. I couldn't speak Spanish. And she kind of looked me in the eye and said, she's the most important person in the world for me. And I'll never forget that. It was such a poignant moment for me. This is what we do. You know what I mean? And that's the great blessing of the art we practice, that we are so blessed to do this. So I felt very blessed. And the last slide I have is on Caro Imparo. Michelangelo, when he was dying at the 83, the last line he says is Ancaro Imparo, and still I learn. And all of you that are part here, you learn, we learn, we're all together in this. And it was a real privilege to be here. I apologize about my computer crashing, but it's great to be with you. Thank you for the opportunity, and I'm open for discussion now. I'm at 45 minutes. I was right on time.
So over to you, Shalini.
Yeah, oh, that was a fantastic talk, Dr. Nanda. I think we all enjoyed it. And despite being a very, very busy neurosurgeon, you have the appreciation for poetry, for history, you're a literature, and there are so many qualities. I wonder how you weave that all into your practice. And when Vidya told me to be a moderator in this session, I didn't even know what I told. I just know the literal meanings of poignancy, and I'm not even sure what is the punditry in healthcare. I was thinking, is it expertise? Is it what is it? And it was nice to listen to you and your introspection into what we do, and then your the way you tied it up with paintings and poetry and literature, and it was a really nice. It was a beautiful expose of of us in medicine, of what we face in medicine in day-to-day lives, and as surgeons, what is important, and not to. Now I've got the word punditry means maybe overconfidence, or you just saying, yeah, I can do it, and you do it, whether there's evidence or no evidence. So I'm not sure if that's the message that you wanted to give across, that we need to be very, very, what do you call it, sensible in our approach to a patient, and yeah, so on and so forth. So let's hear from Dr. Patta, Dr. Radhakrishnan, and then maybe take the questions in the chat box. Thank you. Thank you so much, Dr. Nanda.
Thank you so much.
A lot of friends of Dr. Anil Nanda are on call.
Okay.
Would you like to listen to their comments, or is it okay if I go ahead with you?
Go ahead. They'll be there. I mean,
yeah, and actually, I remember Dr. Anil Nanda as a tall, fair, handsome person walking down, and I thought I used to feel small seeing him and walking down and talking, and no wonder is that he's one of the tallest persons in the field of neurosurgery. My first comment will be actually when surgeons start talking philosophy, it's that they have reached their end of their career or over the peak or whatever. And, then you see all same philosophy going on. And again, Dr. Nanda, if you see, it's only surgeons who talk philosophy. Is it because they have committed something in their life as compared to physicians who have omitted something in their life?
Well, one of the slides I did have was that when they looked at the data on internists, and again, I don't mean anything offensive, every 10 years, 30 to 40, 40 to 50, every 10 years, the mortality as you get older for an internist increases like 0.2%, 0.3%. For the surgeons, it's the other way around. Every 10 years, like if you're over 60, you have the best results. So I'm 67. I'm like, okay, that means I can still do my brainstem stuff. But I think because your muscle memory is better, and I think, wisdom is something that comes from experience. You're like, this is my mom. I probably wouldn't do this. You know what I mean? But when you're young, you're like a cowboy. You're like, okay, I can do this. I can do anything. I'm immortal. And then you're like Arjun, I'm like, oh my God, I need Lord Krishna. I need the Sanatana Sarthi to tell me, maybe I should do this, maybe I shouldn't do this. So I think that all my plea is that, listen, have some uncertainty about yourself. Don't be hubristic. I think the dean of the medical college in Cornell said once beautifully that half of what we teach you is false. Okay? The problem is we don't know which half. I think that's true. You're like, you don't know which, So I think, it's like when I was a medical student, vagotomy, everybody got a vagotomy. And now today it's not done. You're a general surgeon. I don't know if you still do those vagotomies or it's a rare thing,
Rare thing.
And so it changes, I think my thing as you get older is you just realize what a blessed journey it's been. You know what I mean? That we could practice this great art that I'm in awe of. You know what I mean? That I could go to one of the best medical schools in the world. I mean, I really think JIPMER, phenomenal education. When I gave a talk to the med school, I told them, to whom much is given, much is expected. If you go to one of the best med schools in the world, you need to be grateful and you need to do something in return. You can't just say, I went to JIPMER, Maple, we're going to be fine. No, no, no. You need a little bit more. Yeah, no.
So, Dr. Nanda, if I can ask you, what drew you as a neurosurgeon to explore the intersection of poignancy and punditry in healthcare? But these are two concepts which are not often discussed in surgical circles. I don't know if anybody ever spoke with these titles anywhere else. They're very, very strange, and you combine them. And as a neurosurgeon, what made you talk about these?
I think what I was upset about was I was a young attending, okay? I was in LSU. excuse me, and I went down there. I went to a national meeting, and one of the greats of neurosurgery, Ransohoff, I'll say his name. He was a chair at NYU. He was a very cavalier guy. He comes up and says, I've done 100 acoustic neuromas. Everybody goes home post-op day 2. And I'm like, that's BS. That's not what happens. My patients are still in the ICU post-op day 2. And then I talk to the residents, and I'm like, we just talk about the triumphs. And the problem is medicine has become a marketing thing. We have these mythic heroes in medicine that if you go to this person, A, you'll be cured of cancer, B, you'll have no complications. Now, their complication rate may be low, but it ain't zero. And what happens is when you go to sort of, and I've been part of these things, I wrote a book on complications. What happens at these meetings is I don't like young people getting I should be doing this. I can do this. That's dangerous. So if you don't have that humility, but all you have is hubris, then you're like Icarus. You fly too close to the sun and your wings are going to melt. Your wings are, and all of us have been to that. Our wings are going to melt if we fly too close to the sun. And I mean, you look at our Indian mythology, you look at Karna. Karna was a great person, but he was in bad company and he dies a death. Arjun kills him. And I think our parampara, our historical stories are so beautiful that they bring out this whole thing about hubris, I mean, the classic example I give is, Lord Krishna is with Arjun during the Mahabharata and he protects him. And so Arjun gets a little cocky and he's like, okay, you're the charioteer, you get off the chariot first. But Krishna says, no, you get off first. Arjun gets off, and then Krishna leaps from the chariot, and the whole thing explodes. And then Arjun realizes, oh my God, Krishna is the one who protected me. And so his hubris disappears. And we're all like that. We think, oh my God, I did great. I took out a brainstem tumor yesterday. The guy is intact, looks beautiful. And then I'm like, but for the grace of God, the guy could have woken up in a coma. You know what I mean? And I would never want to impose my faith or anything on anybody. But each of us has this Rosetta Stone that makes us tick. For me, it might be faith. For somebody else, it may be love. We don't know. And I would never be judgmental about it. But I just think, gratitude is the memory of the heart. I'm grateful to JIPMA. What a great institution. You know what I mean? I'm grateful to Dr. Chandrasekhar. I'm grateful for the friendship of people like Monica Wasakan. I see William Kisku's on. Kisku was a great guitarist, as you will remember. So wonderful people. And in life, you go through with either a gratitude quotient or a resentment quotient. Happy people are always grateful. They're like, no, Laika, we're gonna be fine. You know what I mean? And then there's unhappy people, no matter what you do, they're like, life's horrible. So I do feel physicians have become more cynical. I actually read a great article in the Wall Street Journal about a book by Dr. Wachter yesterday. You're talking about electronic medical records. Electronic medical records have become the bane of our existence because, and what he said beautifully, it's like having a baby that you have to feed continuously and change their diaper continuously, and the baby never smiles back. And that's what we face. They just don't smile back. They're like, you got to do this, you got to do this. So I think, I mean, I just feel be grateful, be kind, be gentle. And that's what we don't want the next generation of physicians to be cynics. We don't want them to be pessimists because that's not our divine nature.
When I was a trainee in AIMS in GI surgery, often we used to be called to the neurosurgical unit, because there's a coffee ground vomiters, patients constipated, etc. But none of the patients ever communicated or saw, or we don't know whether they're alive or dead. And actually, when you look at it as clinicians, if you don't see a patient talking to you or communicating with you and the whole ward is silent, I mean, doesn't it make you feel sort of disconnected with the patient?
No, I think, I'll tell you, I just, we all grow with our personal experience, okay? Uh, our journey is our journey. Nobody can teach that to you. I always tell my kids, I can't teach you this. You're going to have your knocks and downs. You're going to suffer. I was an intern at Hahnemann Hospital. I was a third-year neurosurgery resident. There's a black guy that came, Rastafarian hair, just one of these drug addict kind of guys. I took out his subdural. I was a resident. I did the case. And I went to the mother, who was looked like a really nice lady. And I was kind of indifferent to her. I said, well, we did what we could. He died. And then she looked at me and says, he's my son. You don't know what this means to me. And it was like a dagger going through my heart because I'm like, oh my God, my mom loves me just as much as his mom loves him. And I was callous, I was indifferent, and I was wrong. And that's how you learn. That no, I can't tell anybody that. That's yeah. I'm actually writing a book of fiction, which is partially autobiographical, called Paralysis. I'm halfway done with it, and I recount all these stories because these stories make us who we are. I think Odysseus says in Tennyson's poem, "I am all who I have met." And we are a product of our patients. And in most of you, I'm sure, Shalini, Vidya, yourself, you remember your disasters. You remember, oh my God, I did this. You know what I mean? And those are the things that they are Kintsugi bowls. They are the bowls that got us through.
Now, can you describe the clinical movement that fundamentally changed how you think about the emotional landscape of patient care?
Each person has his Rosetta Stone. That's what makes them click. For me, it was always my faith. Okay. I was a devotee of Sai Baba. I went to Puttaparthi when I was a young person. And I would never proselytize somebody. Or, my dad was a Vedantan who believed in Advaita. My mother was a Bhakti yoga person, and never the twain shall meet. So my dad had this quotation from Jefferson that, you judge somebody's faith not by what they try to change you, but how you treat other people. And I think that was everybody has something that makes them tick. And for me, that was what it is. It was my faith that made me who I am and gave me a sense of humanism. And even in contemporary philosophy, look at Brene Brown, who's one of these sort of feel-good philosophers from the South. And her line is, every morning I want to wake up and see the face of God in people I meet. It's a simple thing. And that's what Krishna tells Arjun. He tells Arjun, whoever sees me in all beings and sees all beings in me is dear to me. It's a line to live by. It is the summum bonum of Hinduism, that you see God in all. And I think that's when I gave a talk once in Puttaparthi many years ago. I said, Matra Deva Bhava, Pitru Deva Bhava, Acharya Deva Bhava, and Patient Deva Bhava. That's humility that we treat everybody. And I think it's hard. We tend to have stereotypes. The drug abuser, Rastafarian here, what the hell am I doing? And I think that, and I can tell you, as much as we try, nobody's perfect. We all make mistakes of prejudice, of preconceived notions that are probably not appropriate. And you learn to be better. You know what I mean? And I think there's a wonderful book by Henry Nouwen. I would like all of you to read it. It's called The Return of the Prodigal Son. And it's based on the biblical parable and he says we all go through the stages. We start out as the prodigal son. We're resentful. You want to go to rock concerts. You disobey your parents, all this sort of stuff. Then you become the elder son and you're like resentful. Well, why is he getting the property? I worked so hard. I did a great job. And in the end, you become like the father, who says, unconditional love to all. I think I still get stuck in the older son phase because sometimes, the Republicans will, why are we treating these patients? They have no insurance. Why can't they get a job? And the truth of the matter is, how can we be judgmental? You know what I mean? These are the poor. We need to take care of them. I always say advocacy in America is how do doctors get richer? How do they get paid more for work? Advocacy in the world is how do the poor get more coverage? And that's the difference.
Now, is poignancy something that can be taught in a medical school or is something clinicians must discover for themselves?
That's a good question. They have a lot of empathy classes in medical school where they do these impersonations. How do you break the news that your family's dead? So in neurosurgery, if you watch the series Pit, they have that and that. Somebody goes brain dead. I'm like, I don't like watching that series because I do this every day. But I think what you want to do is, I think if you have some scene impersonations where a patient comes, how do you break bad news to a patient? I think that's an art you could be trained on, that you need some sensitivity. But some people are, on the spectrum and they don't have the social cues. And we see that, by what specialty they pick. So I think it's a personal journey, but you must strive for that. As much as I can talk about sensitivity, I'm still guilty of cynicism. You know, we're all guilty of it. Who among us can say this is perfect? Yeah.
Now, I'm sure you will be addressing the general public at times, or you're in a television show, and when you're asked questions which are not exactly related to your specialty, but something in medicine, how do you reply? Because you may have some knowledge, but because this is what, like for Vidya, for instance, will be faced by patients every day. The relative saying when things went on well, how the patient going to recover, what will be the outcome. I don't know how Vidya deals with all those questions to which she has no exact answers. How do you deal, Dr. Nanda?
Again, repeat that. How do
No,
I
no.
deal
See,
with?
you may be asked questions
Right.
a public forum, on a television interview, on things which you're not a specialist in. How do
Oh,
you
okay. Well,
get it?
I don't give advice on things I don't know. I mean, I think one of the things that I said is we lived in a post-truth era. We do. I mean, you think about vaccination, I mean, we got a Secretary of Health who's like, I mean, I hate to say this, he's crazy. You know what I mean? Don't believe in vaccination, don't believe in this. So I think we have to go in the areas that we are clear the zone is perfect. You know what I mean? That we can sort of, don't get out of your lane. I mean, I'm not going to tell Shalini, why is the C-section rate so high in your hospital? That's for her to figure. I don't know enough about it. I do know in America, the C-section rate is very high because you get reimbursed much more for a C-section than a natural vaginal delivery. That's just the facts. You know what I mean? And I think that's one of the things I worry about. I gave grand rounds in a very prominent institution, and the resident tells me during the discussion, why should I do a simple back operation if I can put screws in and get 4 times the reimbursement? This way, I'll get a Ferrari before I'm 40. I mean, I felt like crying listening to that. I mean, I would fire that resident. You know what I mean? Why, that's the wrong person. And it's like Dr. Death. I mean, we see, you know people that have hands of death and destruction that probably shouldn't be practicing. And we sort of, we put up with it like, okay, what are you going to do? Yeah.
No, actually, there are a lot of your classmates and your contemporaries online here, and we are a few years junior to you. What are your unfinished tasks, or how are you going to spend, say, next decade or so? Focusing on what?
Well, I think, listen, when you get to my age, the pump could stop anytime. Okay. I mean, that's the whole point of memento mori, I mean, we have dear friends. I mean, I have two classmates, Balasubramaniam and Radhakrishna, who was brilliant. Okay. He passed away. So we are lucky, but anything can go wrong at any time. And I think this way you come back to the Gita. The Gita says you never forget God, never trust in the world, and never be afraid of death. And I think, I mean, I think you want to do good. I want to finish this piece of fiction I'm writing. I'm coming out with a comprehensive textbook on meningiomas, so I want to do that. And then above all, I want to be a good grandfather. I became a grandfather last year, and I was very close friends with a guy that ran a mega Baptist church. I actually operated on him. Fred Lowry was his name in Shreveport. He had 30,000 people in his church. He always finished his sermon with one line. It comes down to faith, family, and friends. At the end of the day, nobody is going to remember what your H index was, how many books you wrote, what organizations you were president of. This is all ego. It's all ego. The people that remember you are your kids, your grandkids, the children, the patients you took care of. So we should have no illusions. Our current president thinks he's immortal. You know what I mean? We have every airport named after him. But there's no immortality. You know what I mean? There is no immortality. And I think, that's a way to sort of all of us, to go through all this. Yeah.
Dr. Nanda, it's wonderful listening to you. And one last question. What is the single most important message you hope clinicians take away from your talk today?
I think humility. I think the one thing our profession sometimes flaws in is that, humility, compassion. There's a line, and it was one of the last slides that my computer went saw, but there's a line when the Middlebrook in Connecticut, 17 children were killed in a massacre. Okay, there was a gun shooting accident. And Maureen Dowd, who writes a wonderful column in the New York Times, had a priest write a column for that. And she quoted this theologian, Keenan, from Boston College, who said, mercy is entering into the anarchy of another. Mercy is entering into the anarchy of another. We as physicians practice that every day. And that is the compassion we should have. I mean, if you look at any language, karuna is a beautiful word, Sanskrit word. And it means so much that we should have karuna. We should have humility and karuna to make us better. We all strive to be better. And, it's a hard thing to accomplish, but, we try.
Thank you. Vidya, back to you. And
So, Chandru, you had your camera on for a while. Do you want to say something?
Yeah. I don't know that I can say anything to follow this, Anil. I don't know if you remember me. I'm Ashok's younger brother.
Oh, that's right. That's right. I was supposed to give this talk in Texas. Yeah.
Yeah, so I was very keen to log in today. I don't know if one more of your patient stories I have. I live in Colombia, which is probably about 1,000 miles from Shreveport. And I was talking to him, and he said, I had my neck operated. It was a great surgeon. I said, I know only one neurosurgeon from Louisiana, and that is you. And it was you that operated on his neck. So he did about 20 years ago, and he was a army vet and moved over here. But one of the questions I had, as I trained in transplant, and we take 10 hours to do one transplant. But I think overall, the amount of good that a doctor can do is probably more as a preventive and social medicine person rather than, doing these major surgeries. And uh, that's not in my ballpark, but that's what I've been feeling for a long time.
Yeah, I mean, I agree with you. I think it's, you prepare for it, you hope for it. And, one thing I like to encourage younger people is to read widely. I think your brother is a big Vedantan. He's wonderful with Advaita. He's always talked philosophically about it and in a very rich way. And I was just with him at the reunion. So I just think we constantly work at keeping our intellect and our faith sharp. And I tell the younger guys, I read the Wall Street Journal, the New York Times every day, and I read a bunch of books. And I think that keeps you, it keeps you grounded. You know what I mean? I think that's important. And there are other people. My wife just listens to podcasts. That's what keeps her going. So everybody has their thing that makes them tick. I think it's just a blessing. It really is. I mean, I'm so happy you saw one of my patients. I used to operate a lot in Louisiana, so it was a great blessing to be there. And it's interesting. The South, like the Indian South, the American South, are very similar. The fabric of faith is very real. So, when I went down to the South, I was like, oh, it's all Jimmy Swaggart, television evangelist, and I was shocked. Like, I operated on a small cord tumor with no insurance. And he says, I pray for you every night. oh, like this is better than Blue Cross. You know what I mean? So I think that's something that you have to appreciate culturally, that people are, that people have that. It's sort of a humbling thing, you know.
Dr. Anurag Bhargav, we have been there right from the beginning. Would you like to say something, Dr. Anurag?
No, I enjoyed the talk, Dr. Nanda's talk. I have similar interest in history of medicine and literature, and but I think our students and residents are exposed to too little of it at their formative stage. So I think we talk of medical humanities, but we don't really pay attention to it in the formative years. So while it's nice to hear Dr. Nanda, but in our own setups, we need to bring this, and not as a separate course, but as example at the bedside. So otherwise, there is a hidden curriculum that we say something in a course, but at the bedside, we don't practice compassion or poignancy, recognize poignancy. But I enjoyed your talk, Dr. Nanda. Thank you very much.
Thank you, Anurag. But I think what you say is important. Maybe we should be doing more educationally to teach people this. I know the schools in America are doing this more. The curriculum includes humanities, and they have things like play acting. They go and see a museum and look at art and say, how does this painting move you? I think there was a wonderful theater. I don't know if you saw the play called Wit. It's about an academic, Kathleen Chafflon played it. It was an academic poet who has metastatic cancer and is dying. And they had a good movie with that too. And I tried to tell people to see that movie, young residents, because, the resident comes in, he's completely detached, and this is like a big academic person. And they were cold and callous with her. And then she realized as a teacher, she was that way too. So I think we all come to these crossroads that kind of these things happen. But I know that one of the comments that Venkatesh had was that those who are at peace with themselves are capable of giving peace to others. It's hard to practice empathy when the stomach is empty, the heart is aching, and the good life fleeting. And I agree with that. I mean, I think, there's certain economic conditions that you have to have before you can preach or say, I can do this. But, Whitman has a wonderful poem, the American poet, who said, happiness now, not for another hour. Happiness here, not in another place. And I think that's sort of even our Hindu philosophy. Just you have to be happy, you have to be grateful. And that comes from an inner strength that we all strive for. Nobody wants to be unhappy. But you're right. If you're hungry and you don't have the economic necessities to survive, it's difficult to preach to that.
Kalyani, you have your camera on. Are you free to talk?
Yeah. Thank you, Vidya. Okay. So, Dr. Nanda, thank you very much for the talk. This is the second time I'm hearing. I am from JIPMER 96 batch. Dr. Vijay Goel put your on our WhatsApp group that we have, JIPMERites of North America WhatsApp group. She posted your joy and jnana in the journey of JIPMER on December 31st. And while I was cooking, I watched that 1 hour talk that you gave at JIPMER for your reunion, 50th year reunion. So then I talked to Vidya and we talked about, you coming over. So this has been a 6 weeks journey. But there are some intersections. So I'm a medical oncologist, so I am into philosophy a lot because that's what, you have to tell patients and you have to, at the end of the day, so going through after the discussions with the patients, that's you have to go on to the next patient. And one of my colleagues, actually, one of my friends and colleagues I work in Dallas. So I shared a newsletter and I put your joy and jnana in the journey of JIPMER in that newsletter. And I shared with this friend and who said, oh, I know Dr. Nanda. He was at LSU for many years. And I was an pulmonary fellow there. I was IP interventional pulmonary fellow. And he is marvelous and an amazing neurosurgeon as well as a great mentor. So it's it's wonderful that that you have some connection. I've never met you before, but I feel like I'm connected. And so, thank you very much for giving this talk here. And I enjoyed. I took notes. You can see I took notes. Yeah. And all
Well,
this.
we're all family. It's Vasudevaya
Yeah.
Kutumbakam. You know what I mean? We're all family. At the end of the day, we're all brothers and sisters. We're going to the same goal. And, they say memento mori, think of your death. And then they say memento amores, think of love. And in the end, that's what binds us. And Sheikh Farid was this guy, was a contemporary of Guru Nanak. And his famous couplet was, I do not want a knife to stab the world. I want a needle to stitch it together. And that's what we all do. We try to stitch everything together. We don't want to stab anybody or anything like that. But thank you
Thank
again.
you.
Thank you for your kind comments. I appreciate it. And this has been a great privilege. There's a lot of Jipmerites on. I love you guys. We had great memories and we're very blessed. We went to, I'm a little partisan when it comes to this. People talk about the Dallas Cowboys. I'm partisan about Jipmer. Jipmer Machan, Amma Machan, hi, hi, hi. I just love the
So,
place.
yeah, Dr. Nanda, we have now 400 plus Jipmerites, and Sham, Vishweshwaran, and I, we collected all and we have a database of 400 plus Jipmerites. And this Saturday, we are hosting our first virtual meeting, bringing 4 Jipmerites as speakers, and Sham is the host. So this is Saturday, Valentine's Day.
Excellent. Send me the
Thank
link.
you.
I'll definitely come.
Yes. Okay. Great. Thank you. Will do.
Yeah. So Sriram, also a batchmate of Nanda, is also on the call. Sriram, would you like to say something? I know you typed in the chat box. Would you like to turn your mic and camera on?
Is it Sriram Rajgopal?
Yes.
Oh, I love Sriram. He and I were in St. Columbus in the 7th grade together. Then he went to another school. The guy is brilliant. The one thing I will tell you, all my classmates from Jipmer, they were brilliant. They were really smart guys, and gals, of course. Yeah.
We also have Suresh Lakshminaran also on the call, but I'm not sure his audio is working. Suresh, would you like to say something? So by the time Suresh and Sriram get ready, Colonel Harikrishnan, you have your camera on. Would you like to say something?
I always make sure that you notice my camera is on, Doctor. Thank you so much. But I would have failed my duty if I didn't compliment Dr. Anil Nanda. Dr. Nanda, I got one important message for you. Somebody asked you, I think it was Dr. Patta who asked you, what are your plans for the next 10 years? You simply need to put down all these wonderful quotations in a book. They're not yours, mostly are quotations from elsewhere, but I think that could lead to a lot of teaching. And the most important takeaway for me from your talk has been your absolutely unaffected show of humility. I think all of us could do with a little bit more of humility in our spheres. And you stood tall, as somebody else pointed out. I'm not trying to flatter you because I'm not from Jipmer, I'm from Maulana Azad. But the fact is, I've always wondered why Dr. Vidya keeps a huge list of Jipmerites for all the talks. And every time I feel, oh, this is justified. Now I'm not going to complain against this at all, Dr. Vidya, because you have produced one of the finest speakers I've ever had the pleasure of listening. And please, Doctor, put down all these things, and when you write your memoirs, or fictionalized or otherwise, make sure that you convey this message, which I picked up from a book given to me by my wife when we got married 41 years ago. And you should have read it. And if you're not, I'll be very surprised. William Nolan's book called The Making of a Surgeon. In the last page, he tells you what it is to be humble more than anything else that you achieve in your surgical career. And I've always tried to follow it. And I'm sure you're an outstanding example of such humility. And thank you so much for this wonderful talk.
No, thank you very much. I don't deserve that praise. You know what I mean? I
Oh,
always
you
have
do,
the
you do.
imposter syndrome. I always look back. They meant to call, I give these orations. I'm like, They called me by mistake. I want to look behind. They really must have called somebody else. I'm just substituting.
All right. If you want something to tickle you, let me tell you that I was a bit upset about your comment on Halstead. He's my hero. And Halstead was not a flawed man, as you quoted, because he became a drug addict not out of choice or out of boredom. He became a drug addict because he didn't want his patients to suffer pain. In those days, they used to hold them down and pour alcohol into their mouths before operating on them. And he experimented with a new drug one of his friends had brought from South America. And that happened to be an opioid. And in the process, he got addicted. But here is the trick. Here is the comeback of a great man. Did you know that he
Absolutely.
was
You're
the
right. I mean,
first?
Halstead was a genius. He was a
Yeah,
genius.
he was the first person to be appointed as the chair of surgery in Johns Hopkins, no less. And why? Because he came back from his addiction and did something fantastic, which most people couldn't even dream of. Like you said, operating on his own sister for gallbladder, but he introduced blood transfusion. He introduced the surgical gloves, for God's sake. None of us would be operating if it hadn't been for him and for his love of his operating theater scrub nurse, whom he later on married. So he is a great man. So please, that one small remark has been expunged from the records, please, Dr. Vidya.
When somebody has a name like Hari Krishna, how can I not listen to him? It's like the Sanatan Sarathi is speaking to me.
But I loved your remarks about the Bhagavad Gita, and I really appreciate that.
Punithan,
the one last episode I'll tell you about this is something we have 2 minutes, I'll tell you this. So sometime when you're operating, you get a big disaster, okay? Aneurysm ruptures, like I showed you, carotid artery rupturing. So when Draupadi meets Krishna, she says, when they were dishonoring me, which is probably the sentinel event in Indian culture, the disrobing of Draupadi. And she tells him, why didn't you come when I called you? But Krishna, being so nutcut, he says, you said Dwarkamai. You didn't say Rudayavasi. If you had said Rudayavasi, I would have been there instantaneously. But you said Dwarkamai, I had to come from Dwarka. But that's Krishna's nature. He's so nutcut. And so I always say when I'm jammed in the OR, I'm like, Rudayavasi, bail me out. This is the time I need your help. So with a name like Hari Krishna, you can't go wrong.
Puneet, if you're on the call, would you like to say something? Puneet there?
No, actually, I missed the beginning. I was out, but I'm happy that I'm going to see. Everything that I've heard so far is resounded with everything I believe in. So I'm definitely going to catch the recording day after tomorrow when you put it. For once, we're doing it so quickly. I'm really looking forward to this session. I can see that it is brilliant and really something to look forward to.
Shiva Pillai, also a Jipmarite, has logged in from South Africa. Shiva, would you like to say something?
No, I just wanted to say fantastic talk, and it really makes you come back to ground. I had privilege of working with somebody like that, with Mandela, and some people just have the ability to look beyond what is there to something beyond. And we were lesser mortals. We struggled with that concept because we just saw the problem now. We couldn't see things beyond. When you look at Anil here now, you can see he has come to that level. I wouldn't have recognized him. I used to remember he used to be our senior, and this smart, handsome guy used to be walking briskly from the mess. Looking now like this, he has really matured and has come to. We are so proud to have been associated with JIPMA and with people like you. So when I stand up, I say I got friends like this and that from JIPMA. So I got to stand up also. But it's great to see you. Great to see what you're doing, and your humility is something that we all aspire to, and we really hope that we can learn lessons from that, because your ego takes over you. Sometimes you do small things, you feel you did something big, till you see somebody else doing bigger things than you, and then you really feel, this is different now. You need to go to that level, and you showed us to what level we could go. Thank you.
Well, Shiva, thank you so much. I like the Ganesh on your T-shirt. I was privileged to go to Robben Island. I've been to Cape Town a couple of times, and I went to Robben Island. And that man, you're right, Nelson Mandela was like Gandhi. I know we're running out of time, but Graham Fegan is the chairman of neurosurgery in Cape Town. He's a good friend of mine. And the day Madiba dies, he sends me a message. Madiba is no more. That was the word they used for Nelson Mandela. And all I could think of, my mother reminiscing when Gandhi got shot. She said she was like 12 years old. They were all weeping. She, her grandmother, they were weeping. And I felt that sadness when this great man died. He taught us the power of forgiveness. I mean, anybody else who'd been in prison for 23 years or 30 will come out angry, bitter. And here was a man, he was full of karuna. He had this love for everybody. And, we could all learn. It's a great way to end this session. Thank you so much, everybody. It was a privilege to be there. My namaskaram to all of you. And may God bless you in your journey. And may you all be happy and peaceful.
Thanks, Anil. We hope to have you once again in the coming weeks or months. You could choose some other topic to speak on. Till then, thank you everyone for logging in and for making it such an interactive session. We'll meet again next week with another episode of Marvelous Medicine. Till then, take care and stay safe. Good night.